What happens to the breast after your third delivery? This is the topic of our discussion on this video today. My dear subscribers, you are warmly welcome. Those who have not yet subscribed, please subscribe to Dr. David Reproductive Health channel. Then you like and share. My name is Dr. David AYEM. I am in Bamenda, Cameroon. You are a midwife, you are a reproductive health expert, and of course, you are a doctor. I've chosen to be with you, discuss issues that have to do with reproductive health. Excuse me. The topic of today has to do with the breast. Remember, excuse me, just remember, my dear subscribers, the breast are accessory organs of reproduction. The breasts are on the chest of the woman. The breasts are the same organs that the woman uses to feed the newborn baby. The breasts are those structures that produce milk. The breast play a great role in reproductive life, in sexual life. But certain changes may take place as you age, as you grow old. That is the topic of our discussion today. What happens to the breast after the third delivery? For those women that have been giving birth, you have given birth the first time, you have given birth the second time, you have given birth the third time. Is there any change with the breast as from the third delivery? We are not talking about a woman that has been pregnant 3 times. Remember, pregnancy, getting pregnant, is different from giving birth. We should also know that there are women that have been pregnant quite a good number of times, but have not been able to carry a pregnancy to a term, to 9 months, have not been able to give birth, either through the vagina or by a CS. Somebody has to give birth to a baby somehow. But a lot of women have been pregnant and lose the pregnancy, maybe still in the early stage, when it was still 2 months, 3 months or so. Either it was an induced abortion or it was what they call a spontaneous abortion or a miscarriage. You know, people like to use that word miscarriage. It particularly refers to the type of abortion which is spontaneous. Yes, but miscarriage still refers to abortion. Now, a woman that has been pregnant 3 times or more may not have remarkable change in the breast compared to a woman who has actually carried pregnancy till 9 months and has given birth 2 times, 3 times or more and have been breastfeeding. The thing that I want to draw your attention to in this video is that the breast remains healthier when you breastfeed your baby vigorously. When you give birth and you take good time to do breastfeeding to your child, because the baby's mouth, the suckling action of the mouth of the baby on the breast stimulates more and more the production of prolactin. It's a hormone from the pituitary gland in the brain, which now ensures secretion of milk from the tissues, from the special cells of the breast. The milk cannot even secrete well if prolactin is not enough. But we are told the more the baby sucks, the more it stimulates the production of this hormone and the more the quantity of milk produced. When milk is produced like that, it is stored. You know, it is transported through certain channels, we call them lactiferous ducts, and then stored in what we call lactiferous sinuses, which are also called ampullae. They are like they are like reservoir. They are like chambers where produced milk is stored there. Then the little chambers where milk is produced from the lobules, from small sacs that we call them alveoli in the breast. When this milk is being secreted and baby is not sucking vigorously, there is going to be accumulation of milk. When a woman doesn't breastfeed the baby vigorously, the breast is instead at risk. And the kind of risk which begins with accumulation of milk, that the accumulation may start causing engorgement, enlargement, which may now cause an inflammatory process, and bacteria, microorganisms may grow there and cause a serious inflammation that may even end up with abscess of the breast. And imagine if abscess occurs in the breast, they may have to incise that breast and treat the abscess. Is your breast still going to have a good shape? Is it still going to be in a good structure? Certainly no. Are you still going to use the breast very well? Certainly no. Even your partner, like the husband, is he still going to be very attracted to your breast? Certainly no. How do you maintain breast health to remain healthy? Please, for the women that are duly married or they duly have children, they have been getting pregnant and giving birth to children, your breast health relies much on the quality of feeding of your baby. A lot of ladies instead think that when you do not breastfeed the baby, you are preventing sagging of your breast. I am going to shock you that as an expert on this domain, your breast will sag even more, even earlier, even faster if you do not handle the process of breastfeeding well. Rather, the more the baby sucks, the more it empties the tissues in the breast, keeping the breast healthy. Women who truly breastfeed, they even go to a certain age in life and their breasts are still healthy. Even though with aging, it is inevitable that the breasts will sag to a certain degree. They can never just remain as firm as they used to be. But be careful, if they are not well used, the sagging process is faster. Try and have children and practice exclusive breastfeeding. And then even after 6 months, when you wean the baby, that you only bring in supplement, you only add food, but you still continue to breastfeed your baby, even up to 24 months. World Health Organization recommends that. The more you breastfeed, the better baby you have, the better brain it builds, the better IQ, what they call intelligence quotient. So please, people should not joke with their breast. Nature provided the breast, and nature knows that the breast is there for, to keep your shape. It is there to feed your baby. And then when all of this is done, the breast stays healthy. Stay away from breast abscess because it will damage your breast. Stay away from infection, inflammatory processes of the breast. You may notice one part of the breast looks swollen and reddened, painful. That is mastitis. Mastitis. It is a problem. Stay away from what will cause cracks on your nipples. A woman that has been breastfeeding and not taking good care of her breast, and then allowing the nipples to crack, having wounds, will depreciate the breast faster. These are certain complications of the breast we take care of, so to maintain good health of the breast, no matter the number of times you get pregnant and give birth. It is only your attitude. It is only the approach, the way you care for the breast. Don't forget the other aspect, that a duly married woman A woman with a healthy sexual relationship permits her partner to touch her breast, play with her breast, suck her breast. You know, they keep the tissues of the breast healthy. They stimulate circulation of blood in this tissue. Don't forget that anything that can cause stasis, stagnation, accumulation of fluid in the breast can only end up with complications, health complications. Keep your organs healthy. Just like people will go for exercises, people will go for sports. There are certain organs that also need massage, that also need stimulation, that also need, the breasts are one of such. Women who give birth, your babies automatically play this role even without your knowledge. So take good care of your child, feed your child well with the breast because that's the natural food for the baby. Do not try to deprive the baby of the breast because you are afraid that your breast will sag. No, no. Any of such restrictions or resentment will instead lead to sagging of your breast. And it may be sagging now with complications, as we say, like abscesses, like mastitis, like cracks on the nipples, like inverted nipples. Just imagine a lady whose baby is not sucking vigorously. What is going to happen? Some of them have inverted nipples. Some of them have flat nipples. With such nipples, even if baby wants to hold to suck, now you can easily have cracks. You can easily have wounds, which will even prevent you from breastfeeding. And then milk now will accumulate in the tissues of the breast and cause inflammation and cause trouble. And they start taking you to hospital now to treat problems of the breast. Now, if you have been giving birth up to 3 times, your breast can remain as healthy as possible, depending on the care. That is the lesson we want you to get. You will find some ladies with breasts already sagging when they have not even given birth to 1 child. How then can you explain that situation? Now, it is not only about sagging, okay? The tissues themselves age, and even cells that are aged begin to shrink naturally. These are the things that we have to take note of. How well you live your life, right to quality of what you eat. It is going to determine the health of your breast, whether you are even getting pregnant and giving birth or not. That is the topic, that is the lesson I am passing to the world today. My name, Dr. David AYEM. I said I am your reproductive health expert. And please make comments or ask questions on the comment section. I will also give you contact. You can discuss with me one-on-one if you wish, on WhatsApp, through messages or voicemail. Now, these are the numbers. +237. Remember, I'm in Cameroon. That code, +237, comes first. Then you put the number 694-353141. Thank you. Bye.